exactly. And this was a young woman who came in pre-op planning for myomectomy. You can see that her entire uterus, is quite enlarged. And you can see that the entire myometrium is completely replaced by these, um, what look like typical leiomyomas,
Yeah.
and they're all um, very confluent. You can see, however you look at it, you know, they're pretty confluent. Signal-wise, they're all, pretty typical leiomyomas. On post-contrast images, they're all typical leiomyomas. But you really don't see anywhere a single area of normal myometrium. Just entire thing is replaced by fibroids. And this has a name, which I'll find in 1 second. Sorry. And this is called leiomyomatosis. Diffuse leiomyomatosis of the uterus. It's actually quite rare. According to this article, only 14 cases were reported. And then, this particular article looked at pathology and like clonal expansion, and they actually showed that this was all these leiomyomas are from monoclonal expansion of benign tumors, which is kind of interesting. They're
What was the
uncommon.
patient symptom?
I'm sorry.
Was the patient symptomatic?
Yeah, so I forget. Hold on 1 second. She
Bleeding,
had
maybe?
they suspected adenomyosis or posterior fibroid, and they were planning myomectomy. Um she had one baby. She was she's P1. Um and they somehow they wanted to do some they went to myomectomy, so obviously they can't do myomectomy because there's nothing that they can do. There's no normal myometrium. It's actually pretty shocking that she was able to carry a pregnancy with this.
So I spaced out for a second. Are they going to do a UFI? Like that could help with
I'm
symptoms?
not. I don't think she has symptoms. I think she desired pregnancy. I think that was her problem. I know she was cancer. I'm not sure you can. Can you do UFI with all this extent of disease? I'm not sure.
I think so because, and I think it would decrease the size of them and also decrease bulk symptoms and bleeding. We have a lot of patients here that have like extensive, fibroids almost to this extent, and they still do UFIs on them, and it can really help their symptoms.
Right. Right. So, but I think this is a distinct entity from just having a lot of fibroids. I think because they're confluent. I'm not sure. I'll just shoot an email to the provider, but certainly they can't do what do you call it? Um,
Myomectomy.
can't do myomectomy. Yeah. So, okay, this is all for me.